Good morning, everybody. For those of you who are fortunate enough to be here in person, I hope you had a good coffee break or health break. For those of you who are online, whether it's good morning or good evening for you, thank you for joining us. We have a session now that will run for an hour, so we only have 15 minutes, and we'll try to be very strict on that for the three presentations. I don't want to take time just to welcome everybody. Remind you that if you are online and you want to ask questions, you have to type them because you cannot use the microphone to connect to the room. So please do that. We're going to be checking those questions. And I said we're going to be very strict on time for the presenters. And there was something else I was supposed to say, which I forgot. So
are you going to be timing the presenters?
Yes.
Please do.
Yes.
Let us know when.
Absolutely. Yes. The other thing that I had to say, I remember now, sorry that I forgot, is when you make the questions or the interventions, whether it's online or in person, be mindful that we are recording all of this, so we need to be kind and polite to each other. So that's it. Now, the first presenter is, I'm going to go with the order that is here. So, the first presentation is going to be on equity analysis on the acceleration strategy for adolescent girls in Latin America and the Caribbean used in mixed data, a multi-country analysis. And we have our very own Liliana who's going to present that. You have 15 minutes. Go ahead.
Thank you, Enrique, and thank you, colleagues, for joining this session. And thank you, Bristol colleagues, for the support. I want to acknowledge also in the room the presence of our Global Mix Coordinator, Attila Hanshoglu. I should have acknowledged you in the previous one, but thank you for joining us today, and thank you for joining this session. So my name is Liliana Carvajal. I work for UNICEF in the Regional Office for Latin America and the Caribbean as a Regional Mix Coordinator and also a Data and Monitoring Manager. And in this capacity, I'm also supporting the teams, the program teams, and engaging with them in analysis using data about priority areas for UNICEF in the region. One of those priority areas is adolescent girls. As UNICEF, we have a strategy, a global strategy for finding accelerators that can help improve the well-being and conditions of adolescent girls across the globe. And in the Regional Office of Latin America and the Caribbean, we have conducted an effort to contextualize, regionalize that strategy, which means identifying what are the key aspects that we can work in the region to improve the conditions of adolescent girls. I'm leading this effort along with colleagues Shan and Rada Noeva from the Regional Office and with the gender teams in the region. So we have structured this analysis to examine the key socioeconomic determinants of the disparities across regional areas of acceleration, and I'm going to go about those in a second, for adolescent girls in the region. So as I mentioned, UNICEF has identified some key accelerators for adolescent girls, and the accelerators are on the screen and are basically gender norms, girl empowerment and participation, health, nutrition, sexual reproductive health, menstrual hygiene and health, learning and transition to work, freedom from violence and harmful practices, and economic security. So one of the tasks for conducting this analysis is to identify proxy indicators within the mixed surveys that can help us understand a little bit of these aspects of these accelerators in the region. And we have called those outcome indicators. We have used those and also come up with the following research questions. So how do specific socioeconomic determinants affect those outcome indicators for adolescents or those outcomes for adolescent girls across the accelerating areas identified by UNICEF? And then we're very interested in looking if those inequalities compound, right? For example, is the effect of wealth different in these outcomes for urban and rural adolescent girls? So we have started to do some initial analysis of bivariate analysis to get a sense of the compounding effect on the differences. This analysis is structured in two phases. In the first one, we have analyzed data from 5 countries. In the region, all happen to be in the Caribbean. Cuba, Dominican Republic, Guyana, Suriname, Turks and Caicos, and with surveys from 2018 onwards. We have used 2015 as the baseline for all the surveys we're going to be analyzing, thinking of 2015 as the baseline for the SDGs. And we have used all data from IPOM's mixed harmonized data sets. The IPOM's colleagues here? No. So I mentioned this already. We are conducting secondary data analysis and to identify these proxy indicators and identify the socioeconomic variables. So I'm including here 3 of the pillars that of the acceleration areas that we have looked at. For the health, nutrition, and sexual and reproductive health, we have included antenatal care for visits for women younger than 20, HIV counseling during ANC for women 15 to 19, and use of modern contraceptives among girls who are married or in union, and we have selected stick with married or in union as a proxy for sexual activity, sexually active girls. For learning and transition to work, we have identified the outcome internet use, given the importance of access to internet for education. And for freedom from violence and harmful practices, we have identified child marriage. An aspect here of the region is that some of you may know that adolescent birth rate is very high in the region. It's the second after sub-Saharan Africa. And so it is child marriage, in which we haven't seen any decline. So those 2 aspects are very important for, for the conditions of adolescents in the region. We're looking at a few socioeconomic variables: urban-rural residents, wealth index, and education of girls. And we're controlling at the moment for country, age, and education. We've been conducting some literature review in which is coming very clearly the big disparities in outcomes for adolescent girls in the region. For example, for key health interventions, girls in urban areas are doing better than in rural areas. Small countries like Guyana and Panama have been showing the largest geographical inequalities among the regions in health outcomes. Contraceptive use shows markedly lower coverage among adolescents in most countries. The region also has an issue in terms of sexual and reproductive education. It's almost banned across most countries. It's not like possible to speak about sexual and reproductive health at schools. And also it's pretty taboo in the communities and in families. So hence you have high levels of adolescent birth rate and lower use of contraception. So all comes together. In terms of some evidence also from the literature on internet use, also we see big disparities. The urban population have benefited from digital inclusion at a greater degree than rural, for example. And child marriage in Latin America and the Caribbean most often takes the form of informal union. So when we talk about marriage, it's not like official or religious marriage, it's like marriage or informal union, which is very common in the region, in which girls live with a partner rather than formal marriage. Child brides are more likely to reside in rural areas, to live in poor households, and to have less education. Across 4 countries with data, at least 3 in 10 women who married in childhood were subjected to violence by an intimate partner. All right, so it is, and we have a much broader literature review. Those were just key findings, but it is against that backdrop that we have conducted the current analysis, in which we have done a pool analysis from the 5 countries in the Caribbean that I mentioned. We have conducted univariate analysis first, used to determine levels of indicators, bivariate analysis used to identify overall inequalities, and an initial sense of compounding analysis using wealth, the interaction between wealth and residence. For this, we have modeled 2 outcomes with control variables. For the first research question about the key socioeconomic determinants, we have used logit models on all outcomes, given that all outcomes are dichotomous. And for the second research question about compounding, we have used logit models with an interaction term between urban and rural and wealth. We have dichotomized wealth as the poorest are the 40% poorest, and then the highest 60%, so to have a dichotomous variable there. We're looking to see if that's the best approach, and that could be maybe a refining of the analysis in the second phase. So the initial set of results are here. This is the result of the pool analysis. These are 6 models that we have conducted, and every model goes by the outcome indicators on top, ANC4, HIV counseling during ANC. which is, we have used that as a measure of quality of care for maternal health for girls. Use of modern contraceptives, as I mentioned, and this is among married women, internet use, child marriage, and violent discipline. And I have 5 minutes. So the sample sizes across each of these models vary, but they are over 1,000 girls. Some have like 6,000, and you'll see that in the next screen. As the time is short, maybe we can look at the concentrate on a couple of indicators. For example, child marriage might be very interesting. We see the total at the bottom of child marriage in the region, in this set of countries, is 32%. When we look up on top for urban areas, it's 30%, rural areas is 36%. But when we do the compounding, let's say combining rural and poorest, which is rural plus the poorest 40%, we see that that proportion increases to 42%, right? And that is sort of like expected in this type of analysis, because we are compounding, we're putting together the two segments that are usually most deprived, rural and poorest, so we see that increasing. We see that also in the same form, perhaps in the same direction, perhaps less intense violent discipline. The region also has a problem of violent discipline. As you can see here, the total is 62%. We see that when we compound rural and poorest 40%, that increases a little bit to 67%, and urban poor 70%, right? So we see that that's the direction where the analysis is going. We don't see such marked differences or compounding effects yet in sexual and reproductive health indicators, but just a reminder that this is the first phase, and we have only 5 countries. I'll tell you more about the next phases to see if we see refinements in these results. A little bit of the actual logistic regression results here. I have marked on yellow the significant results, and we see, for example, in antenatal ANC4 visits, girls with secondary education are almost 2 times as likely to get antenatal care visits. If we move to violent discipline, up on top, rural kids, rural girls are, no, let's look at the poorest. The poorest, 40% are 1.4 more likely to be subject to violent discipline, and so on. So we are seeing some significant results here at the moment, and you can see at the bottom, in the total, the sample sizes for each of the models. In internet use, for example, we have a sample size at the moment of 7,000. Also violent discipline. So this is quite good enough for this analysis. So we may have like 2 minutes, right, Enrique?
Just 2 minutes.
Okay. Well, so a few of like results here, or the discussion rather, while country level variation in outcomes were clear by various associations, were not always striking. As we saw in the previous screen, health services outcomes show somewhat less inequalities than ICT services like internet use, child marriage, or violent disciplines. And models do not show a compounding effect as expected of inequalities, but point strongly toward the influence of wealth on outcomes, which give us, some potential for proper policies and programmatic interventions. The next steps that what we call like phase 2 of this analysis, we're planning to include 7 more countries in Latin America that have had a survey since 2015. Include additional variables for socioeconomic determinants like mother's education, geographic location, etc., and include additional outcome indicators related to the accelerators. We're going to also, these are the surveys in white are the ones that we're going to be including in phase 2. This is just like a data scoping. We don't need to go into this detail, but just to see we're considering other indicators, in particular for the acceleration areas that we include in this first phase. For example, for gender norms, gender empowerment, we're including gender discrimination, attitudes toward domestic violence, for which we have enough countries with data, 10 and 12. And we're looking into economic security is an acceleration area for which we don't have a very clear indicator at the moment. So if anybody has any suggestions, welcome. Poverty, we're looking into poverty-related indicators. So Enrique, we can have a conversation about that. So that's an area that we really need to look. And for learning and transition to work, we are including, at the moment, as you saw, we included internet use, but we're looking into completion rates, given that for upper secondary education, given that there is huge variation from like 40% to 90% in the region. So that would be a very relevant indicator. We're also looking into refining the compounding analysis, reconsider the definition of rural poor, urban rich, maybe do different cuts, having lowest 20 as a poor instead of lowest 40, looking into test associations, different, how these differ across languages, English, Spanish, and produce country level results for countries where we have sufficient sample size. Some references here, and this is all. Thank you.
Thank you very much, Liliana, and right on time. The next presentation is Living Arrangements and Development Outcomes of Children in East Asia, an analysis of policy implications. And we have our own Jay, who's going to come and present. And if I may say something, which I didn't remember or knew yesterday when we started our conversations. Jay was present at the first mixed conference that we had in 2004. And one of the chapters in the book that came out of that conference is authored by Jay. So thank you, Jay, for doing this.
Good morning. So today I will be presenting the living arrangements and development outcomes of children in East Asia. And this paper is actually jointly done with two of my colleagues from the Thailand country office. It is actually Rafiq and Nataliya, and Rafiq basically works in the social protection team, and Nataliya is from the social policy team. So this is a kind of very brief and very quick analysis we have done, so we haven't gone too much into the details of this, so it will be a very short and presentation with some basics in terms of analysis. So first of all, the context is, the whole thing starts with the CRC, basically. That you all know that CRC is the kind of Bible when it comes to child development and child-related issues. So then again, this issue of, children living without parents and orphans, all those things also were highlighted during the Millennium Development Goals, starting way back like 2000. So that is the kind of context. And then we looked at also some of the data. Then we have seen a lot of things happening in terms of how children live. It is changing rapidly over time. We also hear a lot, but we thought it is good to look a little bit deep, solidly with the data that is coming from the mix. We also have other data that provides similar, more or less similar information, but we didn't go into that. We just limited our analysis to the mixed data for this paper. Maybe we will add further when we progress on with this analysis. So when we talk about living arrangements, we have looked kind of 2 or 3 groups, and we haven't gone too much into all these categories you are seeing. One is living with both parents, okay, children living with both parents, and then children living with biological mother alone. That means the father is not there. And third one is, either of them living with. So these are the 3 groups, categories we looked into, and then we looked at different kinds of, development outcomes within these separate categories. How children are faring from this group versus the other groups. So again, children, I think you all know, you hear different kinds of definitions of children. But for this particular analysis, we have used the kind of UNICEF and CRC kind of definition of children that is below 18 years. But even in this same countries I am using, some of the countries actually use different age groups, even by the government. But for this analysis, we are going to stick to the 0 to 17 years or below 18 years. So the main objective is basically to analyze the trends, how the living arrangements are changing over time in these 3 countries. So we are looking at Laos, PDR, and then Thailand, and then the Vietnam. These are the three countries. Why we have taken this? These are the three countries, we have data from mix for more than one kind of round. We don't have other countries from that East Asia part. But if you go beyond, then there are so many other countries. So we looked at, how the living arrangement is affecting the outcomes of children or how they are treated. So those are the things we will be looking at, and based on the analysis we tried to come, but these are all still in progress. So some of the things I may say at the end may change once we finish, our analysis moving forward. So as I said, data, again, Laos we have used for 3 rounds of mix from 2012, 17, and the latest one, 2023. And Thailand, we have used 4 surveys. Thailand is one of the countries they were doing mix every 3 years. So you have, more surveys to look at. But again, that is up to now. But now government is changing that frequency to 5 years, as similar to many other countries. So you won't be seeing another mix coming for Thailand in 2025. So it will be 2027, so like that. So Vietnam also, we have 2 rounds available for the current. And next Vietnam survey is actually in the process. So it may be delayed a bit, so you won't be having another kind of survey that is coming within the 5-year period for Vietnam due to political reasons. So some of the data limitations and or limitation of this study is we are only going to focus, the children, they are in the households, living in the households. We are not looking at children, they are in any kind of institution, because mix only collects data from the households. So that is the reason we don't have any kind of data for the institutions we are not using. But moving forward, again, we try to bring in some of the data available from other studies and sources, and we try to incorporate, but at this stage we haven't done that level of analysis. So we are planning to do that as well. And another is we don't have any kind of cohort data looking at how children's living arrangement is affecting long time. So it is all kind of survey time and a point kind of information available. So it is not any kind of cohort or something. So that is also another limitation we have. So now looking at the trends, I think my presentation is all simple kind of bar charts. There are no fancy kind of graphs, so bear with me for that. So if you look at this, you can see 3 kinds of sets of bar charts, 3 different colors from 3 countries. So this is the kind of trend you can see in terms of percent of children living with both parents. It's actually going down in terms of percentages. You can see that all of them is going down with fast pace. Especially if you look at Thailand, half of the children are not living with parents. So it's like huge proportion. They are not living with both parents. So what will happen to them? And long-term impacts of those kids not living with, we don't know at this stage. These things need to be looked at further, and definitely we have to commission more kind of studies to look at long-term impact on children, but we don't have. I have looked at internet and all, some studies are there but not solid. From some developing countries and US there are some, but not many studies there giving us any kind of information. So some of the rural differentials and urban differentials, again you will see that the pattern is slightly different when it comes to Laos, Thailand and Vietnam. See, urban rural, they are not having the same kind of trend or pattern. So that is also linked to the economic condition of the country, as well as the kind of working environment and whether people are moving from one place to another to get a job, all those local conditions also matters when it comes to explaining the difference when it comes to rural urban from Thailand to Laos as well as the Vietnam. We also looked at the wealth quintile differences. Again, you can see that the wealth quintile difference, Laos is kind of behaving slightly different from the other two countries. That is also again linked to the local kind of conditions. And this graph, it gives actually children living with neither parent. So that means when it comes to Lavopedia, almost 10% or 9% of the children not living with any of the parents. It's also a huge number. Look at the Thailand figure. Look at the Thailand figure. It is much higher. So 25% of them, none of the parent is there. So these are all huge numbers and huge number of children not living with parents. So what will happen to them? Vietnam, of course, it is 6. Again, that is increasing, not even flat. So some of the indicators we have looked at in terms of comparing, how these different groups of children are figuring. So we looked at the indicators you can see on the list. So I will go because of the time. I am just going a little bit fast. So when it comes to ECDI, the orange bar is kind of not living with both parents. And the blue one is living with both parents for the top panel. And the second graph is giving the not living with either parent. So you can also see that the differences, they are huge when it comes to ECDI index. And the star you can see here, I have put a star here with the name of the countries here. That means they are actually statistically significant, those differences. If you don't see a star here, that means for Lavopedia, they are not statistically significant. So you can see that difference as well. So they are kind of significant when it comes to not living with both parents for Vietnam and Thailand, but that is not the case with the Lavopedia. Because the Lavopedia, economic activity is low, so the movement is low for many of those people. That's why Lao is kind of faring okay when it comes to this. The another indicators we looked at is books available at home for kids to read, etc. Again, you can see that there is a huge difference, and for all the countries, they are statistically significant. That means if the children living with both parents have more books, more things to do, etc. Now, when it comes to the the school preparedness, percentage of children of the primary school age entering grade 1. Again, you don't see much difference except when it comes to Thailand. Okay. There are reasons I can explain actually. Again, these are all local kind of settings, because also the socialist kind of setting in Vietnam and Laos also make sure that children of young age, they go to the school. But that kind of pressure is not there when it comes to Thailand. Another is upper secondary school entry. Again, you can see the huge difference. When it comes to primary entry, the differences are marginal, but when it comes to upper secondary, the differences are much, much higher. So that means what is going to happen, or what is happening with the kids, they are not living with parents. There is a concern, big concern, and we have to look into that and try to address them. Similarly, the out of school children. See the huge difference. You can see that when it comes to Vietnam, Thailand, the differences are not much, but when it comes to Vietnam and Laos, there are huge differences, you can see. Again, helping with homework also you can see the difference. I'm going fast. Violent discipline, we are not seeing much difference, but I see it as maybe an issue of reporting. Sometimes they don't want to report it. So, if you are a caregiver, whatever you do, you may not report, but at the same time, mother means, okay, it is okay for me to report. So, it could be an issue of reporting rather than the real situation as well. Finally, the last indicator is we looked at is the nutritional status. This one is a little bit funny, the findings, because what we are seeing is underweight is more among children living with both parents. And likewise, the overweight is more for children, they are not living with both parents. This is surprising, but could be these kids are not getting good quality food. They may be getting junk food or very low quality food, or something that is filled to stomach, that kind of situation, that also can create similar situations. So I don't know, but this needs to be further investigated to understand why we are having this nutrition thing not in the expected kind of way. I don't know. I am not an expert on this, but I think I will definitely check this with the nutrition colleagues further to understand why it is happening. And we also will look further in terms of the type of food these kids are receiving to the extent possible, because we have for some groups it is available, not for the entire 0 to 17, at least for the under 5 we have the feeding pattern, and we will look into that further. So I think some of the key findings, again I am not going to repeat. I might have said all these in the earlier presentations, because earlier slides rather. So these are some of the key findings, and finally some recommendations. Again, commitment of the government to take care of these kids, and proper legislation to manage some of these challenges, and community awareness. That is also very important, because orphans are treated differently. They don't get that kind of recognition, and the school, if they go, they don't get that kind of attention. So all those things we have to make sure community is aware, and community should treat everybody in the equal way. And finally, data, lot of gaps in terms of understanding all these challenges these kinds of children are facing. So we also have to strengthen the data to understand these things much more than what we have now. So I think with this I conclude. So thank you very much for listening. Happy to answer.
Thank you, Jay. Thank you very much. Now the next presentation is Social Assistance and Child Adolescent Rights in Eastern and Southern Africa. And I have to admit, I have a question. Who is presenting of all of you? Because I have 3 of the co-authors in the room. Go ahead, you have 15 minutes.
Everyone, my name is Ritapriya Bandyopadhyay, but I go by Reet. I am a research assistant at present at Oxford University, assisting with child poverty analysis. And today I'll discuss some findings from our analysis, which broadly looks at the role of social assistance programs in advancing child and adolescent rights in Eastern and Southern Africa. So just to give a brief background of social protection, evidence from literature has demonstrated that social protection is a powerful tool in ensuring well-being of children and adolescents, particularly in low-resource settings. It is also a recognized right by the UNCRC. And there are 3 major types of social protection: social assistance, which is our focus today, social insurance, and labor market programs and policies. We focus on social assistance because of the nature of the data, as well as because most of the social protection initiatives in the SR region are social assistance programs involving cash support, in-kind transfers, and school support. So this slide gives us the conceptual background which motivated our analysis. So on the left, we have 3 important child rights which are associated with social protection. So number 1 is guaranteed access to essential human needs. then helping families support the growth of their children, and finally supporting children facing functional disabilities. And on the right, we have three opposing social risks: deprivation, orphanhood, and disability, and which act as hindrances towards the realization of these rights. So we have three specific objectives. First, we try to establish what is the association between these social risks and age and gender-specific adverse development outcomes. And then we look at the coverage of social assistance among children and adolescents in the region. So we look at the overall coverage of social assistance, and then we look at how this coverage is distributed by demographics and by the social risks. So just an overview of the data. A new module on social assistance was included in the 6th round of mix. We are looking at two categories of social assistance. The first one is social transfers, which includes either cash or in-kind transfers, and the second category is school support. Our sample includes around 85,000 children aged between 0 to 17 years, spread across 5 countries, which are Eswatini, Comoros, Madagascar, Malawi, and Zimbabwe. One limitation of the data was that, particularly for social transfers, questions of receipt were only asked at the household level. So these are the specific social assistance and social risk questions that relate to our objectives. For social risks, we were able to determine if a child is deprived in any one of 6 basic human needs, which includes shelter, sanitation, water, education, health, and food. We were able to see if a child was orphan or living away from both parents. And finally, we were able to determine if a child had functional disabilities. For social transfers, households were asked whether or not they received any assistance in the past 12 months through a particular program specific to the country context. And then finally, for school support, household members were asked whether they received any school tuition support in the current school year, or whether they received any cash or material support in the current school year. So for our first objective, we performed multivariable regression to look at the association between social risks and development outcomes among children. So as we can see, there are different development outcomes pertaining to different age groups. And so overall, we see that deprivation as a social risk is associated with the maximum number of adverse development outcomes. It's associated with lower literacy and numeracy skills, higher likelihood of participating in child labor, as well as higher likelihood of engaging in condomless sex, and higher likelihood of early sexual debut. And just to mention, our outcome for condomless sex was measured only among females. So once we establish the association, we then move on to looking at the coverage. So from mix, we found that Zimbabwe had the highest coverage of social transfers at 46%, and Malawi had the highest coverage of school support at 31%. We also wanted to compare our coverage estimates from mix with, for social transfers with data from Aspire, which is released by the World Bank. And we found that for Eswatini and Zimbabwe, there is a high difference in the coverage estimates. And we don't exactly know what could be the reason for this difference, but we assume that this is due to the differences in timeline when the data was collected. So for both Eswatini and Zimbabwe, last Aspire data was somewhere around 2016, 2017. However, mix in Eswatini was conducted right after COVID, so it might include social assistance initiatives that were implemented in response to the pandemic. And for Zimbabwe, mix was conducted right after Cyclone Idele, so it may also include social transfer initiatives that were started in response to the crisis. Another interesting thing we note is that school support is mostly concentrated among primary school children, even though primary school has no fees in most of our countries. So we then look at the distribution of social assistance by stratifying it by demographics. So for social transfers, we don't find any difference by age or by sex, but for most of our countries, we see that households in rural areas are more likely to receive social transfers. So in S20, for instance, rural households are twice more likely to receive social transfers. For school support, we see that for some countries, the coverage of school support follows a distinct age distribution. Again, in S20, for instance, school support is mostly concentrated among 17-year-old children. We see that in Madagascar and Malawi, girls are slightly more likely to receive school support compared to boys. And finally, in Malawi and Zimbabwe, we found that individuals in rural areas are slightly more likely to receive school support. So 1.5 times more likely to receive school support compared to those in urban areas. And finally, we look at the distribution of social assistance by the social risk factors. So we don't find any common trend here. The coverage of social assistance differs across countries and by the social risks. But just to explain the numbers, so the 260% for Madagascar represents that children in Madagascar who are deprived are approximately 2.6 times more likely to receive social transfers, so either cash or in-kind transfers, than those who are not deprived. Whereas in Malawi, we see that for school support in Malawi, we see that children who are deprived are less likely to receive school support compared to those who are not deprived. The blank spaces in both these tables indicate that the receipt of social assistance is not universally higher among children and adolescents who experience these social risk factors. We couldn't find a statistically significant difference for these cells. So this brings us to the main findings. We saw that deprivation is associated with the widest range of adverse development outcomes. Coverage of social transfers is higher among rural areas and among children and adolescents experiencing social risk, but there are children experiencing social risk who are not covered by social assistance. The coverage of school support is mostly concentrated among orphans, but we do not find any difference in receipt of school support by deprivation, which might be due to the fact that most programs focus on in-school children. In terms of policy recommendations, our analysis shows that it's important to improve the coverage of social transfers as well as school support to include children who are not covered by existing initiatives. Targeting strategies should consider deprivation because that's the social risk which we found was associated with the maximum number of adverse development outcomes. Awareness of social protection programs should be increased to remove access barriers. And finally, data collection and monitoring systems should be improved to refine child-sensitive social assistance. One strength of our analysis was that we could use nationally representative multi-country data. However, most of the data related to social assistance were self-reported, so there is a chance of measurement error. And as I mentioned, data was collected across different years, so it is difficult to compare across countries. And thank you. This is the whole theme for this work.
Thank you very much. I think we had 3 very interesting presentations, so thank you for all the presenters to keeping on time. That means we have almost 15 minutes for questions. I also want to apologize to all the presenters as I was trying to rush them, saying 5 minutes, 3 minutes, 2 minutes. But you all complied very well, so thank you very much. Questions? I know there is nothing so far online, so we need questions from you to make this a lively interaction. Yes?
I have a question about why there's so many children not with their parents in Thailand. Do you know?
Oh, sorry, yes.
You need to turn it on. Just give me 1 second. Okay.
Yeah. Apologies for that.
So the question is about children not living with their parents, or are they? Is it kinship care? Are they living with their grandparents or another relative, or are they rural children who've been sent somewhere to go to secondary school, or is it a mixture of both? I mean, there isn't a huge death rate of parents in Thailand, so is it the parents are working away, or is it access to secondary school for rural children?
And I invite Jay to answer.
In Thailand, actually, most of these children, they are not living with parents.
Oh.
Okay. They live with grandparents, basically. So most of them, I think, out of these children not living with parents, almost 75%, I think close to, yeah, little more than that, or around, I can't exactly remember, they live with the grandparents. So that way they are not like, in institution, but there are children in institution as well. But I think majority with the grandparents or, another family member. Yeah, so that is the situation in Thailand. And then another thing I didn't mention is also, we are not collecting information about, foster parents. So in the mix and many other similar surveys, we actually ask questions about biological parents. So that is also another limitation sometimes. These days, this foster parents, that proportion also is going up. So we also have to somehow capture that aspect, moving forward. Otherwise, we will be missing some kind of critical information in terms of for policy purposes and, what kind of actions we may have to take to support these kids. Just to add that. Thank you.
Don't go far. I have a Ashraf. If you don't mind, I have a question for him just on this, a clarification. Do we have information maybe from other sources of data about increases in divorce rates or out of wedlock children, which may be the reason why they're only with one parent instead of both? Or we don't have that?
I think there must be some small scale studies available, but we haven't gone too much in terms of looking at that. This was kind of just a starting, at least for me. I am not an expert in this field. So I think we are still working on it and looking at what is available a little bit more to further expand and finalize this paper. So there are some anecdotal evidence that even this divorce rate is going up. That is there. It is proven that as the woman empowerment goes, divorce rate also goes up. Whatever there can be questions, but that is the reality. So in Thailand, the woman empowerment is very high, and if you even look at government sector jobs, almost 60 to 70% of the government employees are females. And same private sector also you can see like that. So that there is actually divorce rate.
Yeah.
Maybe it is higher. That also affects this kind of situation.
Okay. Thank you. Ashraf.
Thank you, Enrique. I think it's
for the
three of them was very interesting presentation. I do have a question for Liliana. I noticed in one of the results that the segment of the poorest, the 40% poorest, the compound one, rural times or whatever, is performing better, for example, for the INC and plus than the urban and the others. Do you have any explanation for this? Is it the existence of slums in urban or something? Maybe you can clarify this to us. The second is for the last presenter. Sorry, I forgot the name. Rita. Yeah. So the question that you use different data points coming from different countries. Maybe it was better for us to see the data collection year for each survey, because it looks like they are not the data is not collected at the same, and this maybe has also some limitation on the results as well that you provide. Thank you.
Yes, thank you, Ashraf. That's a good observation. Indeed, we also noticed that, and we were looking into the coverage of those maternal and reproductive services in those countries. Remember, it's a small countries where, I mean, in the current sample, we have Suriname, Guyana, Turks and Caicos. And in those same countries, the coverage of those services is much higher in rural areas, which speaks about the programs that are happening in the country. So those results are likely to change when we incorporate other countries from the region, like Argentina or other countries with more population and different programming, perhaps. So we also observe that, but we think is coming from those two angles, like smaller samples and specific programmatic approaches in those smaller countries. But yeah, that's why I focus on like internet use that has more of the expected results. But yeah, that's what we're interpreting for now. Thank you.
Yeah, so for the different countries, I think I had one of the, it was in the data slide. We mentioned like the mixed survey countries, but I didn't probably emphasize on this, sorry for that. But yeah, we do have different countries for different countries.
Okay, thank you. I'm going to check if there's any questions.
There's
None online. Okay. We still have 5 more minutes if anybody has any questions or any comments. So I have one comment, and it's you do.
I have a question.
No, go ahead.
Thank you. I have a question for Jay. Sorry, Jay, you got in a lot of questions. I noticed that your results for Laos were a little the opposite for a number of indicators as compared to the results for Thailand and Vietnam, in the sense that children not living with parents were better off, or heading in that direction. So I wonder if there are any discussions at the moment about that, or anything happening that can sort of give some context to that. Thank you.
I think that is an excellent question, basically. Yeah. The reason is Laos is a poor country, right? Very poor. So when you look at very poor countries, little bit better off within, they are the mobile people. Okay, they move and they are little bit better economically. That is the reason. So Thailand is kind of little bit above middle income. So that is the reason I can just see as the reason for this kind of difference. When it comes to Laos, children living with both parents, okay, they perform badly compared to the other group. That means they are mobile ones, they are little bit better off economically compared to the other group when it comes to Laos. But that may not be the case when it comes to Thailand. I think more or less similar thing we can also see when it comes to Vietnam. But Vietnam, if you go back, previous surveys and the recent one, a lot of changes, rapid changes happening in Vietnam. That is also because of opening up. Because Vietnam is a communist kind of setup, but for the last 5-10 years they're kind of little bit more opening up, and because of that a lot of movement also starts happening. So some of those things may be the reason, but again we have to further explore to understand this why again. Thank you.
Okay, last chance. Last chance?
I have a comment to the work that Liliana is doing. I mean, like when we are talking about the wealth and the urban-rural kind of connection, we all know that the wealth index is mainly urban biased. So when we are getting a result with the rural, what I will suggest maybe, now we have in the data the urban wealth and rural wealth separately calculated for urban-rural. So sometimes it's better to use these rural wealth indexes to see how it is performing inside the rural, so that we can learn more about the rural context, whether the rural wealthier groups are different than the the poorer groups, because mainly the wealth index is working slightly same with the urban-rural differentiation. So if you have 40-60, then you can say that, okay, this is more or less the same with the rural and urban differentiation. But if you go in details with the, the urban-rural inside the wealth index, or the wealth index inside these groups, I think you can see more. Sometimes the WASH colleagues are doing this for their analysis, so it's very useful, I think, so that maybe it can be also introduced to the work.
Thank you, that's very helpful.
Yeah.
So we have a minute left, and I have a couple of comments or questions. And I want to tie some of the discussion on social protection that we had in this session and the one we had in the previous session, for those of you who were in both. So we had a comparison in some of the results between the mixed coverage, or the mixed information about social protection coverage, and the Aspire from the World Bank. And earlier today we had mix and ILO. But we haven't done the three-way yet. Aspire, ILO, and mix. But we have to be very careful of exactly what it is that we're measuring. I think they're different because they're measuring different things, although they are under the big umbrella of. So before I tell you what I think my solution to that is, let me go to the other comment, because we also saw it earlier, and I think even yesterday. When we want to connect social protection to some bad outcome, whether it's poverty or not going to school, etc., we have this issue that, and it was mentioned by all of the presenters, right? We don't know if there is a cause and effect, or an effect, one is the consequence of the other. Are they poor and that's why they are receiving social protection, or they are not poor and they are receiving social protection and that's why they are not poor? Now, I'm sure that you have all watched these Hollywood movies where just towards the end, something happens to the hero, and that leaves it open for the sequel of the movie. So I'm not going to answer these two issues that I mentioned, and I am not going to give you time to answer them. I want you to think about them, and we'll discuss them at the next mixed conference. So, thank you very much. No. That will. Well, actually, The Incredibles, I think, took about 20 years to have the sequel, but other movies come on. Yeah, that's right.
Make sure that Jay is there after.
Yes, absolutely. Thank you all very much. Yeah,